right, thanks everyone. Hi everyone and welcome. So my name is Elise Loomis. I'm an assistant professor here at the College of Social Work with prior infant mental health experience. I worked for over 6 years as an infant mental health clinician, specializing in early childhood trauma. And here is Dr. Tiffany Bafor, who's another co-project director on this grant.
Hi, good afternoon, everyone. My role here at the U, I'm an associate professor in the College of Social Work, and I also serve as an associate dean for graduate equity, diversity, and inclusion in the graduate school. So I teach here in the College of Social Work, and really excited to be a part of this grant. I also have previous experience working with infants and children. I've been in the social work profession for nearly 30 years. So I've worked in kinship care and foster care, worked in substance use facilities and outpatient facilities as a therapist as well. So happy to be here.
So I'm going to go ahead and share our screen. There we go. Okay. Hopefully you all can see that first, the main slide. Okay. Oh no, not yet.
Yep. Yes.
Okay. All right. So let me just make sure I want to be able to see you all. Okay. So the purpose of kind of what we're sharing today is to give a little more background about this grant. This is an exciting new grant for the University of Utah. This will be the first cohort of social work students who are part of the grant. So this grant is called Project IPEP. You'll hear us refer to it as IPEP throughout kind of this information session, and that stands for Interdisciplinary Preparation of Early Childhood Professionals for Mental Health Promotion, Prevention, and Intervention. So the title is a little bit different from what you see on the website that we shared, but the goal of this grant is to provide students some training on trauma-informed infant mental health and interprofessional collaboration. So this grant is a partnership between the Department of Special Education here at the U and the College of Social Work, and it's funded through the Office of Special Education Programs. So please feel free, Emily and Susan, to stop us at any point if there's some questions. If you have questions, it's likely that others have questions as well. So the goals of Project IPEP are to improve the pre-service education in the fields of early intervention, early childhood special education, and social work through a number of different training modalities, collaborative coursework, teaming opportunities, and the development of specialized knowledge in early social emotional development, trauma, and infant mental health. So the four of us who are co-project directors on the IPEP leadership team, Dr. Sandra Stegenga and Susan Johnston from the College of Education, and then Dr. Tiffany Bafor and myself through the College of Social Work. So this is really a collaborative grant. The four of us applied for this federal grant with the kind of goal of improving the training for social work and early intervention, early special education students here at the U. So what we noticed is that kind of here in Utah and nationally, there tend to be kind of gaps in our two fields. So for social workers, we often have the training related to mental health and trauma-informed care, but there's usually not specialized training in working with infants and young children and that kind of specialized training on early childhood development. And then in the fields of early intervention and early childhood special education, they tend to have that specialized early childhood training, but may not have as much of that mental health and trauma-informed training. So the goals of this grant are to kind of provide those missing gaps in training for social work and early intervention students, as well as to provide opportunities to kind of learn collaboratively, because these are two disciplines that are going to interact a lot out in the field. And so to give an opportunity for students to practice that sort of collaboration as they're learning. These are the project competencies for the grant. So I won't go through all of them, but I share them so that you all can see. These are competencies that we infuse throughout the different goals for learning. So we want students who engage in IPEP to really have a great grounding in knowledge of disabilities and mental health promotion, prevention, and intervention practices for young children, with a special lens towards recommended and evidence-based practices and database decision-making. It's really important for kind of this training grant that students have an opportunity to practice teaming and collaboration, both across disciplines and with families and other professions. To really understand what's the scope of their practice and what's the scope of other professionals that they'll be working with. There's opportunities within the grant to practice technology use for coaching and teaming, to develop leadership skills. And throughout all of the components of the grant, we're focusing on integrating practices of equity, diversity, and inclusion, so that students kind of leave graduate from their programs and leave this program with an understanding both of how EDI influences the work that they do. They understand kind of how to infuse aspects of EDI in policy and practices that they're doing and in the assessments that they're doing of the organizations that they work with. So these are the components of the grant, and I'll talk about them each a little more. There's also information available at our website. But one thing that I want to emphasize before I even go into this is that the goal of this grant is that students will complete their typical coursework. So for this year, we're recruiting students from the 2-year grounded MSW program. So the idea is that students would go through all of the components of their 2-year grounded MSW program, and that these fellowship components would be things that could either slot into kind of some of the elective slots, or would be additional components that students will complete as part of the fellowship. So in terms of courses that would slot into electives, students in the IPEP cohort, so there'll be 4 social work students and 4 early intervention, early special education students in each cohort. They'll take classes together, one in the College of Social Work and one in the College of Education. So in the College of Social Work, the students will take Social Work 6302. This will be in the 2nd year, 2nd semester of their program. It's part of the child welfare practice sequence, and the course is on trauma-focused interventions across ages, cultures, and settings. And it'll expose students to a range of different trauma-informed interventions for different ages, for the school setting, and an opportunity to really understand and evaluate trauma-informed interventions broadly. And then the course that students will take in the College of Education is, and in special education, is called Collaborative Early Intervention. And this is a special education course that will expose students to different policies and practices within the realm of special education, including, related to the IDEA policies that kind of mandate practices for students who have a disability. And we'll talk a lot about practices related to early intervention. So this is a course that's really specific to early childhood. Then students will take 2 IPE courses. So IPE stands for Interprofessional Education. We're very lucky here at the U to have these specific IPE courses that students can take. One of these courses will be a half credit, one is 1 credit. The Foundations of Interprofessional Education is just a course that students will take asynchronously, so they'll do it kind of online themselves, and it includes some readings related to, what does it mean to work across different professions? What are skills for teaming across different professions? And then 6301, the Interprofessional Telemedicine, Telehealth course, gives students an opportunity to engage in a simulation through telehealth technology. So students will have an opportunity to practice treatment planning and teaming across different professions with a specific case study. In addition to those courses, there'll be an expert speaker series. So there'll be 3 specific events that will be held during the duration of the 2-year course of study. One of the courses facilitated by Dr. Bafor is Anti-Racism in Early Childhood Settings, and she can talk a little bit more about that. Another one will have to do with implementation and evaluating evidence-based practices in early childhood settings. So students will get exposed to a specific tool that can help them with evaluating evidence-based practices. And then the third one will have to do with policy and advocacy in early childhood. This will likely focus on, policies and practices related to a specific current topic. So we're thinking about focusing this one on addressing preschool suspension and expulsion through program and state policies. But the goal of this expert speaker series is to give students specialized knowledge, to have them give them an opportunity to hear from a range of experts who are doing this work in the field. Students will have an assignment that's linked to these expert speaker series. So for example, it might be something like writing a policy brief or in support or related to a bill related to infant mental health. And then the final piece of this fellowship component is a 40-hour joint field experience. So for social work students in particular, this is separate from the field practicum hours. So this is a field experience that's specifically around giving students an opportunity to be in the field and work in settings related to infant mental health. So this will be held in year 2 of in the year 2 spring break. Most of these hours will be held during that time. And students, the social work students and early intervention, early special education students will have an opportunity to collaborate together. So one example of part of this 40-hour field experience will be, we're planning on students spending a day in a trauma-informed preschool setting. So having an opportunity to observe in the setting, maybe volunteer in the setting and get some additional training within that setting. Another opportunity may be shadowing an early intervention professional. What we want is students to be able to get this experience together. So see what do the early intervention and early special education students, how are they assessing or how are they engaging within this experience? How are the social work students engaging? So this is a lot. I'm just going to pause here and see if anyone has any questions about just the fellowship components before we go into recruitment and who's eligible.
I guess I have one question. So we would be free to make plans to do for the first year. So this spring of 2024, spring break of 2024, when we're in the first year, then there are no requirements, no optional things or.
Yeah, okay. Correct. The expert speaker series hasn't been scheduled yet. That'll be during the school year, but we have nothing planned for year 1 spring break. It's the obligation is year 2 spring break.
Okay, that's great. And grounded, I haven't heard that term before. It's in the in-person program.
Sorry, yes, the in-person program. Yep. Yeah.
Okay. I assumed that they were being used as synonyms, sure.
Yeah. That being said, the 2 courses, the electives that students will take are most likely, the 6302 will most likely, students will be engaging in the online version of that, just the cohort of 8 IPEP students. The students from the College of Education, from the early intervention, early special education program have a teaching practicum or student teaching during the day. And so they tend to take their courses in the evening. And so one of the things we've had to do is just align schedules so that this cohort can take courses together. So students in 6302 will take the online version of that, and they'll have an opportunity to engage just as their cohort of 8. And my understanding is the special education course is mostly online. There may be some hybrid component of that course.
Okay, thank you.
Other questions? Okay, so we'll move forward into just eligibility. Tiffany, I think this is you.
Sure. And before we move on to the recruitment piece, I just wanted to mention that I added the program course checklist in the chat. So just wanted to sort of emphasize here that you still have to meet all of the program requirements for MSW graduation. And so these courses that Dr. Loomis just mentioned would actually fall under elective courses. So those are not, these courses for this program are not considered an area of focus. So the areas of focus are aging, child welfare, forensic, global health, mental health, and substance use. So you would still have to select an area of focus. And likely most of these area focus areas would work super well with this program as well, particularly child welfare, mental health, health, global. I think any of those would be a great fit, but certainly students could still choose from among all 7 of those areas of focus. but you would need to complete the area of focus. And then if you look at that course checklist, these courses would actually fall under the elective courses. So these would be taken again in the second year as well. So just wanted to clarify. Are there any questions about that before we move on to recruitment? Okay. So a cohort of 8 students, 4 social work students, 4 early intervention specialists. There will be 3 cohorts, and we'll recruit 8 students, again, 4 students from each program in 2023, 24, and 25. So again, these students are, at least for this year, are going to be recruited from the face-to-face MSW program. And our primary reason for that is because there is a face-to-face component. So we want to just ensure that students are available locally to attend those face-to-face components of the program as well. Students will receive a $14,000 a year stipend for the 2 years. And we say here possible tuition benefit. We'll submit for each student to receive the tuition benefit. Most likely students will receive the tuition benefit, but there are some rules around the tuition benefit program that have to be met. For example, one of those is that students have to ensure that this is their first master's degree program. If it's a second master's, then the tuition benefit program won't cover the tuition. Their qualifications, like students have to be either DACA eligible or US citizens or permanent residents, things of that nature. So as long as folks meet that tuition benefit qualification, they would be eligible for that. So in terms of a timeline, we really wanted to begin with holding the information sessions after students were admitted to the program, and really communicate with students who had already paid their seating fee and were really committed to coming to the U. So our process here is we're asking students to apply by April 1st. And then by the 7th, they'll be notified about their interviews. We'll have the interviews on the 25th and the 27th. And then May 1st, we'll send out the final decision notices. So any questions about that? Okay. So our next slide is just about eligibility, and I did kind of already cover some of this, but really just wanting to make sure that folks are just really passionately engaged in this and are ensuring that they can make the commitment, again, emphasizing that 40-hour spring break commitment over the second year of the program, as well as the ability to complete the required coursework and attend the mandatory interprofessional education series requirements and the expert speaker series. And we do want to ensure that students are really interested and highly committed to working with with infants, toddlers, and children with disabilities after 4 years. So Dr. Loomis, could you talk a little bit about what that postgraduate commitment would look like for students?
Sure. Yeah. So because this is a federal grant, there are kind of stipulations from the feds around a post-graduation work requirement, and it's 2 years of work service for every year of funding. So since this is a 2-year grant, that means 4 years post-graduation. So there's language that's linked, kind of the specific language is linked on the website, and it Essentially what it means for social workers, because the language is kind of geared a little bit more towards teaching and early intervention, because that's typically the recipient of these types of grants. So what that means for social workers is that social workers need to demonstrate each year for those 4 years of service that they're working 51% of the time or more with children, infants, toddlers, or children who may be eligible under IDEA or services, or children who have a disability. So this can include, things like autism. This can include things like emotional disturbance. So there's a range of different disabilities that qualify. And so for social work students, that would mean that at least 51% of your caseload is infants, toddlers, or children, and children are defined as under age 22. So it's pretty broad. Our hope is that, folks go out there and they're able to really specifically work with young children, but from the terms of the federal requirements, it's kind of children more broadly. Questions about that? And on our website, we're going to add a section of frequently asked questions and things that have come up in the past info session. And so one question that came up, which is great, is just what are examples of types of employment post-graduation that would qualify? And so we'll put a list of some examples and folks can definitely reach out. I think one of the things we want to ensure is that students are set up to succeed for those post-graduation work requirements. So that's important for us to be clear about what it means. So for example, something like school social work would count under that. Something like working with children in an outpatient setting would count as a post-graduation requirement.
May I ask a question? So can I clarify that? Did you just say that part of the program is to help us find that post-graduation work, that we have support from the program? Is that what you said? Or
not
is it
formally?
okay.
My point is it's important for us that's why we clarified in terms of what does this language mean for social work students, because we want to make sure that we're conveying that accurately so that folks know what to expect.
Okay, but then it is our responsibility to find work in that field, but we're doing that kind of on our own. You're not placing us in specific places.
No. However, one of the things that we hope can come out of the grant is getting connection to different agencies. So we have a great advisory board as part of the grant, folks who are working all throughout the state in fields related to early childhood and special education, mental health. And so, we envision this being part of networking for students too, is getting to know folks in the advisory board, what types of roles are out there related to infant mental health and early childhood. And I hope that kind of informally can support that process.
Yeah, and develop over time. Okay, thank you.
Yep.
I did have a quick question in regards to the 4 years that we do. Does that have to be within the state of Utah?
I don't think so. No. And okay. I think you have maybe something like a 10-year span to complete that 4 years, if that makes sense. It doesn't need to be the first 4 years after graduation.
Okay, thank you.
Okay, that's really good to know. I didn't read that anywhere else, so thank you.
And there are folks here at the U who have experience with these types of grants. So if there are kind of specific questions, we can definitely kind of reach out to those folks about that. Other questions? I think our last slide is just our website, a link back to our website, which I'm guessing folks have seen, but there's information there. We'll update that with frequently asked questions as well. And that's where you would apply to. The application is not a quick application. It has a number of short answer responses. And we just want to make sure that folks have had an opportunity to really think through what would it be like to be involved in this program? How does my past experience relate to this? Connecting, we have a question there about the diversity-informed tenets of infant mental health. So connecting that to social work values. And part of the goal of this application too is just to give students an opportunity to really kind of get exposed to some of these concepts if they're new to you.
So I have I have two questions. I think a little bit about the application. So my first question is, should we move ahead as normal with this practicum placement, all the emails that we've just recently received about faculty advisors and the list of places and our 10 choices? Is that all, we're just moving through that as expected and just as we thought before this fellowship offer came?
Emily, this is definitely for you, but since I forgot to have you introduce yourself at the start for the recording piece of this. So would you mind just introducing yourself really quickly too?
Of course. So yes, I'm Emily Blyle, Associate Clinical Professor in the college and MSW Field Director. To answer your question, Susan, I would proceed with a placement in your generalist year as you might proceed, normally. So trying to get a generalist experience, maybe finding something that has some foundational benefit to what your future aspiration is, if this is it. So maybe a kind of a mental health setting, school setting would probably be optimal.
Okay, thank you.
Mm-hmm.
My second question was about the application. Specifically, do you have access or will you access our application for the MSW that we turned in October? Like, I noticed, I didn't think you asked for a resume on this application. So are you accessing what we turned in October also, or no? I guess it doesn't really matter. I'm just curious.
We won't be, is my understanding. Nope. So that's why we're asking for a letter of recommendation. I know that they're submitted through the application, but since it's all students who have been accepted, we're assuming they meet, the requirements for the application for the MSW program. Our application is specifically focused on infant mental health experience, teaming, collaboration experience, those sorts of things. So yeah.
Okay, good. Thank you.
Great question. Other questions?
I did have one question regarding the application. So when it says, I think at the bottom, it says to link your acceptance letter. I've just received emails. Do you want it in a different format? I was just kind of curious, like what format would be the most acceptable?
So I think we'd be fine with a PDF of the email acceptance. That's fine. All right, other questions? Okay. Well, if other questions come up, feel free to email us. My email is linked on the website. I can forward any information or any other questions to Dr. Baff or Professor Blyle. And, if things come up, let us know. But thank you for coming and thanks for being interested in this program. We're all just super excited about this as an opportunity for social work students and for the university broadly.